Gender-affirming care for transgender teens has been the subject of intense political debate across the country. A lot of the focus has been on medical procedures, but as our Sonica Bargo found, gender-affirming care is about more than that.
Gender-affirming care is a life-saving practice.
Therapist Cassie Ellison says for transgender young people, access or lack of access to gender-affirming care makes a big difference.
Not doing gender-affirming care can lead to higher rates of depression, higher rates of anxiety.
It can be medical, puberty blockers and hormone therapy, and sometimes for adults, gender reassignment surgery.
So there's multiple pieces of affirmation that don't intersect with the healthcare system.
But UPMC psychiatrist Kristen Ekstrand and queer advocate Minnie Nguyen say it doesn't have to be.
An affirmation is something that occurs across the board in society.
Gender-affirming care can even be like a haircut. Gender-affirming care can even be using the right name, using the right pronouns.
But the medical aspect has become a political hot-button issue. 3 bills involving the young transgender community are in the Pennsylvania House this session, including one which extends the time limit for people to sue over gender-related medical procedures they had as children. I reached out to several mid-state lawmakers who have backed this and other measures for comment. Representatives Paul Schemmel and Don Kiefer and Senator Kristen Phillips Hill were unavailable. Representative Barb Gleim declined, and Senator Doug Mastriano didn't respond to our request for an interview. This political debate can be difficult for members of the queer community.
Policymakers will kind of treat them as a talking point and not like an actual person. It's incredibly dehumanizing.
It's kind of like people are debating your own humanity. And your right to exist as a person.
Nguyen says she understands people's concerns, especially when kids are involved, but she says there's a process to determine whether medical intervention is right for children.
Medical doctors aren't willy-nilly going to hand out like hormone prescriptions. These conversations around protecting the children ultimately undermines the professionalism, not just of counselors, therapists, but also medical professionals as well.
Nguyen also points out cisgender people who identify as the gender they were born can also get gender-affirming care. For example, estrogen for women going through menopause.
By putting the onus of gender-affirming care or something that is specifically a trans thing, it makes it a lot easier to kind of set aside like a population of people that people may not understand or agree with. Gender-affirming care is literally for everyone.
Sonica Bargo, ABC 27 News.